Equine health is our business. Horses and education are our passion.
Welcome to the EquiConnect podcast. Here we have case-based conversation and talk about interesting news and information with the goal of sharing knowledge, focusing on equine health.
This podcast is not a substitute for regular and emergency veterinary care. Our purpose is to inform and educate horse people, not to diagnose and treat medical conditions without a valid veterinary client-patient relationship.
Hi, and welcome to the latest episode of the EquiConnect podcast, brought to you by McKee-Pownall Equine Services. I'm your host, Dr. McKee-Pownall, joined once again by my co-host, Karen Foell. Karen, how are you?
I'm good, thank you.
How are you enjoying autumn?
I'm loving autumn. I love going outside and enjoying the beautiful colors, so this is definitely my time of year.
It's great weather for horseback riding outside.
It's beautiful. I agree.
Excellent. We're really excited to have our newest addition to the McKee-Pownall vet team join us as our guest today. And welcome Dr. Katelyn McNichol from our Uxbridge location.
Hello, it's a pleasure to be here.
Thanks so much for joining us, Katelyn. And now you have a little bit of an accent that we just heard. So where did you grow up?
I was born in Canada, but my family moved to Australia when I was 4. So I grew up initially in New South Wales, and then through my senior high school and onwards was in Queensland.
I have to ask, Australia, it's easier to be the other side of the world, but it looks so amazing there. What made you want to come back to Canada?
It is pretty amazing. It does get pretty hot, like really hot. So it can be a little bit unpleasant taking x-rays and everything in the middle of summer. But I still have a lot of family in Ontario. So like aunts and uncles and cousins over here. And I'm a dual citizen, so I can move back over here and work. And it's something I've wanted to do in my career, is come back and work in Canada and live in Canada and like be a real Canadian. So that's why I'm back, and to spend more time with family as well.
Well, we are really happy you made that move. So now that you're in Canada, or, thinking back to your days in Australia, what do you like to do for fun?
For fun, I like to get outdoors. So I think Canada certainly ticks the box there. Lots to do outdoors. You have a lot of lakes. We don't really have lakes in Australia, so I'm looking forward to all the lake activities. But hiking, also quite enjoy rock climbing. And then I guess on days when I can't get outside, then things like even jigsaw puzzles or like reading a book is good as well.
I think that's the go-to for vets. Every vet I know loves doing jigsaw puzzles. It's just that thing. We like solving things.
Mm-hmm. Oh, yes. Yeah, that's a great way to think about it. Absolutely. Now, we've talked about what you like to do for fun and kind of staying on that path, but diving a bit into work. Where did you go to vet school?
In Australia, in Queensland, at the University of Queensland.
So knowing what you know about Canada, is there much different in the veterinary education in Australia compared to here?
To be honest, I haven't spent a lot of time with many new graduates here to kind of compare what our new grads are like between the two countries. You have some different diseases here, and your management of horses is different over here too, in terms of your barn and having them in stalls, and even just not having grass available to you for half of the year. So there are definitely some different things. But in terms of education wise, to be honest, it's been so long since I went to vet school. I don't even remember what I did or didn't know once I graduated.
Same, very much a big same. So most vets, other than jigsaw puzzles, have a passion for a particular part of equine practice. What's yours?
I would have to say my top pick would be dentistry. I like it all, but definitely teeth are something I've always enjoyed doing through my whole career. And it was one of the first things I really focused on when I first started working as an equine vet.
Very cool. That's awesome. Well, let's stay a little bit deeper into that. So for clients, some common questions that we get are like, why do I have to have my horse's teeth done?
It's a very valid question. It's kind of a big one, though, too. I think to really answer it, we've got to understand our anatomy a little bit more, and that'll give us our answer, basically. So, I mean, first things first, like, how many teeth do horses have? And not everyone realizes how many teeth they do have, because when we lift up their lips, we only get to see, a fraction of their total number of teeth. Like, we've got our incisors at the front, of course, which we can see, 6 on the top, 6 on the bottom. And then in our geldings, or males, and some mares, we'll have our canine teeth, which are just sitting behind them. There's a little gap, and then there's those teeth. And then we have another gap, and then we have our first premolar, which is actually our little non-functional wolf tooth, which are different to canines, and not all horses have them. And then we have 3 premolars and 3 molars on each quadrant. So 6 cheek teeth in each quadrant of the mouth. So that's a total of 44 teeth. So when we really lift up their lips, we're only seeing 16 of 44 of their teeth. So there's a lot going on further back in the mouth. And then we got to look at how they grind, or how they eat, right? So they're grinding their teeth when they're eating. And I think we've heard, and they're grinding them with those cheek teeth. Those are really kind of the ones we're focusing on mostly when we're doing a dental. I think most people have heard the phrase that horses' teeth continually erupt throughout their life. And it's not quite true. They do actually have a defined amount of tooth that they develop. So you've got the bit that you can see in the mouth, the crown, and then they have the reserve crown, which is actually sitting within their jaw, and that can be up to 10 centimeters long. And then you have the root of the tooth itself. So they can have quite big teeth sitting in their heads. And when they're grinding their feed, we end up wearing away part of this surface. And so that reserve crown is what's erupting to actually replace that worn away, ground away crown, right? And so we're grinding away our teeth. The other important thing to know is that their lower jaw is a bit narrower than their upper jaw. So what that means is, with that grinding that they do, we end up with our occlusal surface, so the bits of our cheek teeth that come together, they end up on a bit of an angle. And so when they're grinding away, we end up with sharp points developing on the outside of their upper molars and the inside of their lower molars, so against their cheeks and against their tongue. So when we're doing a dental, it's these sharp enamel points that we're actually addressing.
So in other words, areas that don't get grinded off or ground off as they're eating.
Exactly. So we're addressing that, and we're also looking, our incisors usually look after themselves a little bit if they're in the correct alignment. They tend to, yes, they grind themselves away as well, but they don't have because of the way they come together, they don't get sharp points.
I mean, I'm always impressed. I mean, you take x-rays of young horses and you see how much reserve crown there. It's crazy. Like on a young horse, like basically the side of their heads, it's just teeth, or their jaws.
Yeah.
It's just upper and lowers, it's just teeth.
It's full
Nothing
of teeth.
but teeth. Yeah. And then they get too old and not so much. So the obvious question is why don't wild horses have to have their teeth floated?
I get this question a lot, and it's another fair one. I think firstly, you've got to look at the fact that wild horses are eating very different feed than what our horses in the paddock, our domesticated horses, are eating. Wild horses typically are on much coarser grasses, whereas our guys are getting fed nice, soft hay. You don't usually go for the stemmiest, spikiest looking hay. So nice, soft hay, a bucket feed, which causes them to chew their food a bit, which also affects how they grind their teeth. And then they're on nice, grassy pasture. So they wear their teeth differently than a wild horse. The other thing to remember is, wild horses in reality aren't living into their late 20s, early 30s very commonly, whereas most horse owners want their horses to live as long as possible. So making sure their teeth are well looked after can literally add years to their life if you improve the functionality of those teeth. And finally, we're not riding wild horses. If we're going to be asking horses to let us sit on their back, this is with or without a bit, or even just walking them around with a head stole on, we want their mouth to be comfortable, and we don't want to have sharp points poking into their cheeks and their tongues when we're walking them around.
I guess different from us is like our teeth don't get sharp, and you see those sharp edges either on the inside bottom or outside upper, and they can draw blood, and you get big cheek ulcers. It's kind of nasty in there sometimes when you've seen a horse that hasn't had their teeth done for a while.
Oh yeah, very, very sharp. I've cut my finger on one before.
Yep, very much so.
Oh my goodness. Well, talking about prevention, at what age should horses get their first dental?
So in reality, horses will have sharp points from 6 months of age. They just don't have as many teeth as an adult horse.
Like humans and other mammals, they have baby teeth and then they have adult teeth, right?
Yes, correct. So usually, though, we recommend that horses have their teeth done around 2 years of age. And that's for a couple of reasons. One is this can be the time that people are starting to do a little bit of training with them, or even potentially introducing the bit. So we want their mouth to be comfortable. We don't want any negative associations with your early training with these guys. It is also this age when they're starting to lose those baby teeth that Mike just mentioned, and we want to make sure that they are being lost correctly and that the adult tooth is coming through correctly as well.
I guess the other thing I always thought about too is that because you have that chewing service that we talked about, I think at the young age we're also identifying if there's abnormalities in there that may cause problems later on. Better to start them young than have somebody start breaking a horse when they're 4 or 5 and like, this thing just doesn't want to turn to the left. And then you find out there's a problem there.
Absolutely. The earlier we identify the issues, the more likely we are to be able to correct them and manage them appropriately, for sure.
And so what other age differences are there as they start to develop and age? And, you just talked about 2 years, but there's a lot of going on until they're in their 20s.
Correct. So we then recommend, once they have their first dental, we recommend they have their teeth done every 6 months up until about the age of 6. So this is because we're going through this period where they're losing baby teeth, they're erupting their adult teeth. We want to make sure that, like I said, we're losing those baby teeth correctly, because if we don't, they can actually cause our adult teeth to not erupt correctly. And we want to make sure there's no crowding in the mouth. No issues with this eruption. Plus, our younger horses tend to wear their teeth down a bit faster to those sharper points. They become uncomfortable faster. They develop their sharp points faster. So 6 monthly up until about 6 years of age, and your vet will tell you when the teeth seem to have started to slow down a little bit, because then they do start to slow down. And that's why then beyond that kind of 6 years of age, we go to an annual dental, because that's then generally how long it takes for them to develop their sharp points. You can, of course, sometimes need to have your dentals done more frequently than that if you've got other issues with the mouth, so malalignments, missing teeth, if you're monitoring loose teeth, anything like that. And we also sometimes find our performance horses do enjoy and benefit having their teeth done every, say, 6 to 9 months rather than every 12, just so you're never getting to that point where they're actually sharp enough to be negatively impacting their training and their written work. You're not getting any resistance with the contact, for example.
And what's different with horses as they become, let's call them seniors or geriatrics? What happens then?
Yeah, so we mentioned the anatomy. Going back to the anatomy, we know that the horses have that crown, the reserve crown, and then the root. So once we're getting into our senior years, so sometimes that can even be late teens, but then certainly into our 20s, we start to run out of that reserve crown. So our tooth starts to get a bit exhausted. So we don't get sharp points as quickly as we did before, because our teeth aren't growing as quickly. But then we are really looking at bunch of other issues that we're watching for, and that's things like loose teeth, feed getting stuck between the teeth, which can then lead to loose teeth. Basically, with our seniors, we want to make sure their mouth is as comfortable as possible, so that they can maintain their weight as well as possible into their geriatric years, again adding those extra years to their life. So we still want an annual dental with our geriatric, with our seniors, basically. So even if there's not a ton to float with those horses, we still want that annual dental, because a lot can change in a year, of course, right? So we want to be checking those mouths.
So, Katelyn, I know that in your dental appointments, that part of that is an oral exam. Can you tell us what is involved in that oral exam?
Absolutely. So before we do our dental, we want to do a thorough oral exam. And this is going to let us pick up on any and all pathology that's hidden in that mouth. So in order to do that, we really need our horses sedated. Unfortunately, not many horses are willing to kind of, say, and hold that mouth open and let us have a good look in there without moving their tongue around and all those things. So really sedation is part of the equation for a thorough oral exam. Then, of course, we need the actual speculum that we then to hold their mouth open so that, one, we can see, and two, we keep all our fingers.
Mm-hmm.
Then we need a bright light, because we need to be able to see into this dark cabin. We know there's 44 teeth total in that mouth. They go pretty far back, so we need a bright light. And then we use things like a dental mirror. That's going to let us look at the entire surface of each tooth, because we really can't just see that by looking from in the mouth. We do need the benefit of that mirror. And then finally, we usually use something like a dental pick, and it's going to help us remove feed that is stuck, between teeth or within the tooth, just so we can clean the mouth up completely, so we can really identify if there is any pathology anywhere in that mouth. And then we proceed with our dental.
What I find fascinating when I was practicing, when we first started doing teeth, about 20, 24 years ago, we really weren't using the picks or the mirrors or the lights. We were using lights, we were using sedation, and it's amazing how much knowledge we have learned in the vet profession over the last 20 years of what's going on in the mouth pathologies and what have you. And, you're charting now, just like our dental hygienists do for us as people. It has become much more a rigorous science than it was for sure.
Yeah, for sure. The more you look, the more you see, right?
Yeah, exactly. So a couple of the questions I'm going to ask you now are the questions that I used to get when I was floating a lot. So what can a horse owner expect after their horse's teeth have been done? It's very similar to farriers. There's all these little, let's call them, adages that we have to do. So one of them is, do they need time off? Do they need different feed after their teeth are done?
Short answer is no. So after a dental, your horse should just be happier. They should be more comfortable. We've immediately removed those sharp points. Even if they had ulceration in their cheeks from those sharp points, we've removed the sharp points. They're immediately more comfortable. We've improved the functionality of their mouth. So we've got a happier horse. So once they've woken up from their sedation, and we do need to give them, depending on what was used, an hour or 3 hours to recover completely from our sedation, then they can have the normal feed. The day that they have their dental, they've had that sedation, so we don't ride them that day after they've had their dental, of course, but the next day, absolutely, you just start recommencing normal ridden work again, because they're immediately more comfortable. So you should just, post-dental, you should just have a happier horse. There's no management changes. There's no periods of unease and unhappiness. They're good.
I kind of look at it just like a well-shod horse doesn't need a day off or 2 days off after they've been shod if they've been done correctly. Yeah,
exactly.
Now, often for different things, there's, more common conditions that you see. Are there any common dental conditions that you see more often?
This is another big question, because there are a lot of things that we see commonly. I think we can break them down into a couple of sort of categories. One would be like malocclusions. So things like your overbite. So if you've got like a parrot mouth horse, so where our incisors, our top incisor actually sits further in front of our lower incisors, or if we have things like hooks. So if a horse is going to develop hooks, they're often like up the top at the front and down the bottom at the back. We can have missing teeth, which then causes the tooth opposite that tooth that normally grinds against that tooth that no longer has its grinding buddy, so it doesn't wear away its surface, so it just keeps on erupting. So we end up with this overgrown like step in the mouth. So malocclusions, we do see them quite, like I'd say that's, well, yeah, it's one of the most common things we see, and we're certainly addressing those. We're hoping there are mild imbalances when we see them, because if we're doing their teeth regularly, they don't have a chance to get out of hand. So that would be the first category. The next one would be periodontal disease. So where we have inflammation around our teeth, and that's from food getting stuck either between our teeth. So when we have food getting stuck between two teeth, that's usually like a diastema, what we refer to as the diastema, a gap. Or we can have a periodontal pocket. So that's where food's kind of getting stuck beside our tooth. And food getting stuck between our teeth means there's bacteria between our teeth, and bacteria damages, or can damage our periodontal ligament, which then means food can get deeper into that space, and then it's a little self-perpetuating cycle, and we can end up with a tooth root infection. So we're certainly picking up on periodontal disease when we're looking there. And then fractures. Actually, another really common thing that we'll pick up on. Again, we need that mirror to be able to see some of these, because it depends on how, like, you can have a really obvious bad fracture, of course, but there can be little chip fractures and that sort of thing. And not all fractures are problematic and require investigation or anything, but yeah, fractures certainly are quite common. And there's other things like you can get growths in the mouth, you can get they can get their version of kind of cavities, so caries. But probably the last thing that I'll mention is, with common things, is a condition which I think our clients are starting to become a bit more familiar with, and that's a condition with the incisors, and it's called equine odontoclastic tooth resorption and hypercementosis, which is an awfully long phrase.
That's a mouthful.
It's a mouthful, and it's EOTRH for short, which is also no fun to say at all. But that's a condition that affects their incisors, and you actually end up with, you can get additional cementum being deposited around the roots. So you end up with these really bulbous roots, and it's a painful condition. So bulbous roots, you get bone loss around the teeth, and you also end up with resorptive lesions in the teeth, so holes in the incisors as well. So this is something that happens. It's a progressive, painful issue. It's something that can happen in our middle-aged to senior horses. It's typically the incisors and the canines that are affected. And it's a newer condition that we didn't know about until, let's say, within the last decade or so, that we're really realizing that it's an issue. And yeah, painful. We generally pick up on this when we're doing a dental. They might be painful when they're actually putting their teeth in the speculum, or you can actually see that their jaw is changing underneath their gum line there, and your horse may not want to bite a carrot like it used to because its little teeth are uncomfortable. So that's another really common one that we're starting to recognize and look for more and find more and more. Yeah.
And how do you treat those?
So unfortunately, we don't know why this happens yet. The etiology hasn't been determined. We don't know why it happens. And therefore, we actually don't have a proven successful treatment as yet. So if we have identified these painful teeth in these horses, then removing the painful teeth is actually the solution. And it is a really good solution, to be honest. These horses absolutely benefit from having the painful teeth removed. They get no benefit from keeping the painful teeth. It does slow down how they eat. It affects their weight. It affects their comfort, their demeanor, their happiness, and just chronic pain. If anyone's ever had chronic pain before, we know it's awful. So unfortunately, removing the teeth, and they do really well. So
they do so well afterwards. It's amazing.
They do so well. We never remove painful teeth like this and never not get the outcome we're after, which is a happier horse, that the owners can appreciate the fact that, wow, he or she is a lot more comfortable now that those teeth are gone. So it seems drastic to remove those teeth, but honestly, it makes a world of difference to the horses. It's well worth doing.
I think another thing that is more common now, since, as you said, we've identified EOTRH, but is X-rays of the mouth, of the teeth. So when would you recommend having dental X-rays, or why do you recommend dental X-rays?
Sure. So we've kind of mentioned all of the conditions that we might X-ray to investigate further. So things like fractured teeth, periodontal disease, and EOTRH, even I struggle to say it nicely. That lets us look at the bone around the tooth and also the tooth itself and the tooth root. So everything that we can't see when we look inside the mouth, right? So we get to really assess for bone loss, evidence of infection. We also get to see what shape our roots of our teeth are, and if there's any issues hidden in the jaw there that could then affect our plan for that horse for extraction, for example. Because a lot of the times we can look at doing extractions in the field, in your barn, with them sedated and nerve blocks, so they can't feel anything that we're doing. But if our x-rays identified a problematic root that was likely to break or anything like that, then that's when we know we might be looking at referring elsewhere as well. So radiographs give us that we need more than just the oral exam to really get the full picture or have a better idea of the full picture to make recommendations of whether a tooth needs to come out, whether it needs to be monitored, or whether it's actually okay and we don't actually have a problem.
It's just a great tool to have in our arsenal to really get a great diagnosis.
Well, and something neat that I'm kind of taking away from this as well is that there are quite a lot of things common that happen in horses' mouths. So having those annual dental checkups are so important because things happen so quickly, it sounds like.
Yeah, absolutely.
Katelyn, thank you so much for joining us and sharing your knowledge about teeth. It's obvious. I know when I talk to you and just in general, you love teeth. And you have really brought more opportunities for us to take care of horses better in their teeth. I mean, as you just mentioned before, being able to do extractions in the field, usually we would often refer those to, general anesthesia surgeries, and the fact that we can do them at the farm it's really a great thing for horses and horse owners. So thank you very much.
You're very welcome.
So, Katelyn, that was a very informative discussion on dentistry. And one of the things we'd love to ask you, sounds like this is all completely a surprise and not planned at all, is would you have an interesting case that you could share with us that horse owners would get a lot of value out of?
Yeah, I can definitely think of a couple. But one that we can talk about today would be a horse I saw last year. His name was Teddy. He's a 15-year-old thoroughbred. His owners called us because he had a snotty nose, been going on about a week, and it was really smelly. And most importantly with this, it was just out of one nostril. It was just out of his left nostril that this snot seemed to be coming out of, not both of his nostrils. So I went out and saw Teddy, and sure enough, yep, he had snot coming out of that left nostril. He was otherwise fine, like his temperature was fine, he'd been eating, he was bright, but it really stank, this discharge. So when we have a one-sided nasal discharge like this, it's what we refer to as a unilateral nasal discharge. And it's a pretty important distinction between when we have pus coming out of both nostrils versus just one nostril. When we've got pus coming out of both nostrils, it really says to us that it's somewhere further back in the airway system, like in our pharynx or in our trachea or our lungs. Because if we have discharge from that location, there's no reason why that discharge should be playing favorites and just picking one nostril to come out of. So if you have a unilateral nasal discharge, it really tells us that it's coming from somewhere on that left side, because that's the side he had his discharge on, but his left side of his nasal passageway, because we have a division that runs between left and right.
Just like us.
Passageway. Exactly. So immediately it narrows down where this could be coming from, and really shifts our focus on where we should be looking for this issue. And in terms of what can cause a discharge from just that left side, there's a couple of areas that can be coming from. It can come from your guttural pouches, your ethmoid turbinates, your sinuses, or anywhere in that left nasal passageway.
I don't think people appreciate just how many structures there are in this area here. Like, there's a lot going on there.
True. And it's very much expanded in a horse, right? But there's a lot of areas for sure. The most common place that we would get a unilateral nasal discharge coming from, at least in my experience, is the sinus itself, because our maxillary sinus, and horses' maxillary sinus open into that nasal passageway. The most common reason for a sinus infection is actually secondary to a tooth root infection. And that comes down to anatomy, the fact that horses have 6 cheek teeth in each arcade, and up the top, the last 4 on each side form the floor of our maxillary sinus itself. So there's just a very thin layer of bone that sits on top of our tooth roots. And so if you have a tooth root infection, that pops into the sinus. And then we end up with sinus infection just coming out of one nostril. So with all that in mind, taking it back to Teddy, we have a unilateral nasal discharge. The first thing I'm going to do, and the first thing I did, is look in his mouth to just kick it off and see if we have any dental pathology that could start answering the question of why this is going on with him. So I did just that, looked in his mouth. There was indeed some food that was stuck between 2 of his cheek teeth, 209 and 210. So he had a bit of a diastema there with food. Food means, food that's stuck and rotting means bacteria, which then means you can end up with a tooth root issue. So we had a little question mark. Maybe it could be a tooth issue. That's not enough.
Just let me stop you for a second. What is a diastema for those who have not heard that word before?
Okay, no worries. A diastema is just a gap. So a gap between the 2 teeth. So there was a gap that was allowing food to move into that gap, basically. It does mean that then we can have bacteria and we can end up with a tooth root infection, but that's not enough for me to say, aha, that's exactly what's going on. We need to do a bit more. And the next step then is to x-ray and actually have a look. So when we x-ray the head, we get to see a lot. We get to look at the sinus. We get to see if there's fluid in that area. We get to look at the tooth roots to see if we have infection there. And we also can look at other things like soft tissue structures, ethmoid turbinates. We can also check the guttural pouch. Like, it helps us really narrow down where the pus is coming from that left side, basically.
Because the nasal discharge is the pus.
Yes.
Gotcha.
Yes. We got snot, pus, neck, left side of the nose. Yeah, cool. Correct. So that's what I normally do in the field. That is what I did with Teddy. If we needed to do more than that, we would do things like scoping the sinus and scoping the nasal passageway, etc. But in Teddy's case, x-rayed, and that did give us an answer. He did indeed have pus in his maxillary sinus. So we can actually see, it's normally full of air. And so if we get some pus in there, you can actually see this puddle of fluid in your sinus. So you get this fluid line. And so there's fluid sitting in the bottom of his maxillary sinus. And then we also get to see his tooth roots. And sure enough, one of those teeth that was beside that gap, that diastema, had lost its bone around its root, and the root itself looked unhealthy. So his 209 molar was looking unhappy, so looking infected. And that's certainly enough for us to go, okay, we know the pus is coming from the sinus because we can see a fluid line in our x-rays. And then we also have oral findings, which suggest a tooth. And then we also have some x-ray changes that tell us we have an unhealthy tooth. So yes, sinus infection secondary to a tooth root infection in Teddy's case.
And I know the solution to this, but it's not a fun time.
I disagree.
All right.
No, I enjoy it. Obviously, everything dentistry, and it's not. I think the horses do okay with it as well, to be honest.
No, they do great.
So if we know the tooth is our inciting cause for our sinus infection. Unfortunately, we can't do much to save that tooth. There's very limited things that we can do to save that tooth. So in reality, for a 15-year-old thoroughbred, it does mean removing the tooth is our best way to set us up for success with this. So Teddy had his 209 molar removed. He did not complain about it. It's okay. So that's part of the equation. But then we still have a bunch of pus in our sinus. And that can come out on its own. We can do antibiotics for a long time, but a much more reliable way to resolve this case and reduce any risk of complications or issues with resolving this is to actually flush that sinus and get rid of that pus that's sitting in there and not allow that infection to fester any longer than we want it to, basically. The trick is you can't flush the sinus through the nose. You can't just go up the nose and get into the maxillary sinus. Even though pus comes out of the sinus and goes into your nasal passageway, we can't then follow up. It's quite a small opening. So it does mean we have to make a very small hole into the sinus and then actually flush the sinus that way. So an external hole just into like the forehead of Teddy. It's small, it's under 5 millimeters, it's very small, it heals very well. They don't notice it's there, and we can flush. And usually flush for a couple of days until that bulk of that contamination, until we're no longer getting pus flushing out of our nostril, and then we're relying on some antibiotics to finish mopping things up. And the communication between our tooth root and the sinus is generally pretty small, and it tends to just seal up nicely without us having to do anything further than that, really.
So were you able to do this in the field, or was the horse hospitalized for this procedure, for the molar extraction and for the sinus flush?
Yeah. So for Teddy, the owner didn't have easy transportation, basically, for an easy access to a trailer. So we did do this in the field. That's certainly something that we can do. So the tooth was removed in the field, and yes, we did make a hole into his sinus and flush him in the field. The aftercare for this, sometimes we flush for subsequent days. That can be something that the owners can even do sometimes, or we set you up with a method to be able to do that, or we come back daily to do it. Of course, in a hospital setting, they could potentially, stick around and be flushed daily, but it is something that can be managed in the field. Yes.
Must be really satisfying to do this because, this horse was unhappy, really bad infection. And then I was not going to say an easy removal or an easy process, but you're able to do a big difference.
Yeah, I agree. It certainly causes them a headache, that's for sure. So
sure.
They are happier, even though Teddy hadn't really shown many signs of having an issue. They did report that he was just a bit brighter after we'd resolved this, because it does take a little while for this to brew. It takes a little while for the tooth to get infected to the point to pop into the sinus to then end up with a sinus infection. So it's usually just in hindsight or retrospectively looking at the case, they go, actually, maybe he was a little bit quieter than he had been, or hadn't been vocalizing for his dinner as much as he had been, that sort of thing. So yeah, it definitely takes the pressure off the sinus if you fix it.
No pun intended. It's kind of like us, really bad cold in the winter. We all know what it feels like.
Oh, exactly.
Yes. Now, Teddy is missing a tooth now. What does this mean long term? Like, does this change anything for anything in his future?
Yeah, good question. I mean, him missing a tooth, he's not going to notice. It's not going to affect how, his eating and his weight or anything like that in the future. But, each tooth has a corresponding partner beneath it or above it. They're always grinding. So the fact that we've taken away one of his teeth, it does mean the tooth that is beneath that one that normally would grind against this one no longer has a grinding buddy. So it then does erupt a bit faster than the other teeth and has the potential to actually develop like a little step in the mouth, have a bit of a dominant tooth there as it tries to kind of grow into the gap and try to find where its its buddy has gone. So yes, when we take out a tooth, it does mean that we generally need to do their dentals a little bit more frequently so that we can just grind down that tooth so that it doesn't get out of hand, so that the rest of the mouth can still then grind and function as it always has. Now, how frequently we need to do that does depend on the age of the horse. So horses' teeth, we know, slow down with their eruption the older they get. So you're not going to get this overgrowth as quickly. For Teddy, because he was 15, he had a dental done at the time of his extraction. And then we came back again 6 months later to make sure that lower tooth hadn't overgrown. It had grown a bit, but nothing too much. We could certainly address it in one visit. So we ended up extending his dental interval to every 9 months. And as he gets a bit older, he'll end up going to every 12 months. That'll be fine.
Fascinating. Interesting. Thank you so much, Katelyn.
You're very welcome.
This podcast is not a substitute for regular and emergency veterinary care. Our purpose is to inform and educate horse people not to diagnose and treat medical conditions without a valid veterinary client-patient relationship.